Hi, my name is Dr. Manish Rao. I'm a consultant child and adolescent psychiatrist, and I'm here today to talk to you about autism assessments and what happens. Let's get into it. So, your child has been referred for an autism assessment. What happens next? Well, often there will be a few stages to this. Firstly, that would involve parents, and a questionnaire is usually sent to explore details about some of the early development of your child. This is often then followed up with a conversation with a clinician, which can explore some of those questions in a little bit more detail, sometimes find out a little bit more information as well. Secondly, there would be a need for us to gather information from other sites. That is commonly from schools, and again a questionnaire is sent to them requesting information about what the child is like in school. And finally, and most importantly, there would be an interview or session with the child or young person, and that is often face-to-face but can definitely also be online as well, where there are various different tasks that a young person would do to help us with the assessment. So, what's the best way to prepare for a parent interview? Well, there's a couple of things that can sometimes be helpful. Sometimes these conversations can be challenging to undertake in front of a child or a young person, so trying to find a private space can sometimes be useful as well, to be able to speak a bit more freely if you needed to. But also, sometimes thinking about the early years of a child might have been quite some time ago, and it can be really difficult to remember all of the specifics of the things that might have happened back then. If your child was born in the UK, then trying to dig out their red book could also be helpful. As a reminder, this is a book that's given for every child who's born in the UK, that often health visitors would use to help track the development of children as they get older. If you don't have that, that's fine, and sometimes thinking back to when a child was younger, like when they first started nursery or going to school, and what they were like at those times, that can be really helpful. And actually, if you have any nursery reports or school reports from those early years, that can be of use too, as well. The final thing I'd say is some children and young people have also seen other professionals like educational psychologists or occupational therapists, and actually if you have those reports to hand, that can also be really helpful for the assessment. So how about your child? How do you prepare them for these kind of assessments? Well, actually, in many ways, there's not huge amounts that you need to do in preparation for these assessments. I think it's really important that children are felt at ease when coming for these kind of assessments, and that they're relaxed. So trying to explain to them as much as possible about what happens next and the process can be helpful to make them feel more relaxed. It may be helpful to let them know that as parents you might not be present throughout all of the observation, and we recognise that some children find that worrying or scary, and so speaking about it in advance to make them feel at ease and comfortable can be really valuable. I would also say that clinicians are really experienced at seeing children and young people and helping them to feel comfortable and at ease to help facilitate the assessment. But I also don't want to speak too much about what the assessment involves. It's really important that we make sure we see children in the way that other people would do on a daily basis, and that they're comfortable to engage with it as much as possible. So what role do schools play in this journey? Well, it can be a really important role actually, because we often look for information from different settings. Children spend a huge amount of time in school, and therefore it can be really valuable for us to get the opinions of what they're like in a school setting. But don't worry, we know that they are not experts in these assessments. It's just one piece of our puzzle when undertaking these assessments. So, how much of this should you share with your child? Well, in relation to the process, I think there can be some real value in sharing what happens. Some children find it really important to know what happens next and what the process involves, and actually I think it can really help put people at ease and make them feel comfortable when engaging with the assessments. What about the outcome of any assessment? Well, that's a really difficult question to answer. All children are different, and As parents, you will know your child better than anyone else and understand how much or how little to share with them regarding any outcome. If you did wish to share information about their diagnosis, I would suggest making sure you have enough time to discuss this with them and answer any questions that they might have. Thanks so much for watching. I hope you found this video helpful and you learned a lot about the process of assessments, and I look forward to seeing you in the next one.